Hi, I'm Dr. Gina Lilienthal, and I'm originally from Charleston, South Carolina. My journey into pediatrics started probably when I first had really good role models growing up. I wanted to be an orthodontist because I loved my orthodontist. I thought he hung the moon, and loved every visit. But then, I kept coming back to my pediatrician. He was a great role model for me. I loved going to the doctor. It's nice to have somebody that's that constant in your life. It's one of those things that I just always gravitated towards. One thing I love about working with kids and families is the continuity of care. One reason I picked general pediatrics is the fact that you get to take care of them from a few days old till the time where they're getting married and having kids of their own. And when they bring their kids back to you and that cycle starts over. And there's definitely trust there that is amazing. These people really, they rely on you. I can't just go in and out like, oh, you have a sore throat? Okay, here's an antibiotic for strep. See you later. I love, talking to the kids and getting down on their level and really, someone taught me that years ago, that when you go in, you really need to talk to the patient. And I do that as young as I can. I tell parents, I'm like, you need to talk to your 1-year-old like they're a little person. And they appreciate that. One area of focus that I have in pediatrics is behavioral health. We have, a psychiatric nurse practitioner. A lot of us see ADHD and behavioral visits, and I feel like that's definitely an area that I've gravitated towards. And honestly, it's probably one of the most rewarding follow-ups, that we can have. I had one child and we put her on meds and her coach was the one that was like, oh my gosh, she's doing amazing. And she can follow the plays now, and she's doing so much better because, the attention's there. So that's really rewarding for me. One piece of advice I always give parents and caregivers is you're going to get probably 10 different answers when you first have a baby about how to do something. And that's okay, to basically, and I think that's why we're kind of a grounding force for them, because they come in with a lot of questions. They've heard a lot of different options out there for what's best to feed them, what's best to do, down to what formula is right, what vaccine to give, and I think it's good to let them know, like, it's okay to ask questions, to hopefully read reputable sources of information, and then bring those questions to us. And I think if they trust us, hopefully we can kind of work that out together and decide what's best for the patient.